Oh, the other thing I wanted to ask you too, and I don't know if you even want to mention this, but in your opinion, does the approach of team-based, because I can imagine a primary care provider's life, you have to be all things to all people. It's got to be overwhelming. So with the team-based approach, does it alleviate some of that pressure? Would it, I mean, ultimately, would it make coming into primary care more attractive to some?
I think this is a stretch because there are a lot of factors that add to willingness or unwillingness to come and do primary care, and material portion is not a small portion of the reason people don't want to do this, because the primary care physicians are on the bottom, not the very bottom, but on the bottom list of medical specialties in the country. This is national, it's not just the VA. So I think the team-based approach will not affect that. There will be some other changes if they happen, which might potentially make it more more covetable rather than just the least the least needed specialty for the graduating house staff. I also think that it will require a change in mentality. I have a funny story to tell. One of my very best students this year came to ask for a letter of recommendation. She was graduating from Harvard Medical School with exceptional scores, and she came to ask me for a letter of a recommendation for residency in family medicine, which is virtually unheard of in Harvard Medical School. And part of it is that administration actively dissuades people in elite schools of this country going into fields of primary care, that is family practice, internal medicine, pediatrics, and psychiatry. And HMS is not an exception to this rule. There are a bunch of them that, so it was a very warm feeling to know that the girl who had her rotation here was so enamored with actually serving population that is in need that she decided to apply not even to internal medicine but to family practice, and plans to work in Indian reservation or something of that sort in the future. So what I was trying to say, and I lose a track of thought, that there are a lot of factors that play into this. That being said, team-based approach makes a whole lot difference in my life, and I hope in the life of my colleagues. The ability to practice with an extended team. Matt was speaking about the same day availability of behavioral health consultants, nutritionists, and pharmacy folks creates many opportunities for us, such as interim follow-up, for example, not necessarily with physician or nurse practitioner, but rather with members of the team who have some say in, for example, managing diabetes. So pharmacists can very well be involved in titrating insulin, which does not require a physician level of care each time patient comes over. A nutritionist with counseling, a behavioral health coordinator with speaking about healthy choices and the role of exercise, thus perhaps freeing time for busy clinicians to deal with more complicated patients.
What do you do, like when they first come, residents first come in?
When residents first come in, we do the fairly long orientation, which consists of few parts. We're trying to make them at home in the clinic, we introduce them to the staff, and then we talk about patient-centered medical home as a general concept and how they came up with patient-aligned care teams. After that, we take them on a field trip, so to speak, and take them to their respective RM care managers and let them spend some time, provided that it's allowed in our other orientation goals with the RN care manager. Most of them very well versed into making introduction to the work they do and telling house staff what they can